And perhaps you have those unsightly, around your eyes, those bags that the more you age, the more that they're there, and you just wish they'd go away. There's no reason really to carry that extra baggage. That's why Dr. Jeffrey Raval offers a unique treatment to get rid of bags. Dr. Raval is a board-certified facial plastic surgeon and head and neck surgeon who this year was named one of the top facial plastic surgeons in America. That's wonderful. By the Consumer Research Council of America. And he's back to discuss those terrible dark circles around those eyes as we age and a new technique he has developed for improving that problem. With him is one of his patients, Jeannie, who is midway through her treatment. And also we can't forget about the lovely assistant. We have Debbie this morning. Why do we get those dark circles? Why?
I know, and it happens to everybody. I actually think that for this new technique, anybody over 30 could use this treatment. Because as we get older, we all lose volume in our face. It just happens. We all lose fat, and especially around the eyes, with the loss of fat, we get a deepening of the groove around our eyes. So we all get this groove as we get older. It gets dark also because of all the blood vessels underneath the skin. The skin is very thin, and as we lose the fat, the blood vessels become more visible, and therefore it looks more dark.
Oh, aging. I mean, it's there, so you have to deal with that. And
yeah.
I'm always curious because when you're out shopping and you hear these products that are advertised, a lot of the creams and the liquids, and some say even overnight, over a couple of days,
yeah.
it'll make the magic work.
Yeah, and actually some of them really do work. The way they work is that they're called vasoconstrictors, which means they squeeze the blood vessels down, which makes them less visible. The problem with a lot of these creams, though, is they only last about an hour or two, and then the vasoconstrictor wears off, and then you're back to where you were. So it's just a very temporary fix, but it does work in improving the appearance of the eyes. And
you have this top-notch treatment that helps with that, and you can actually skip over the creams and get right to the root of the problem. And Jeannie is actually midway through her treatment.
Yes.
That's correct.
And so did she really have a lot of the darker eyes? Because it looks great now.
Thank you.
Yeah, and that's actually, why don't you tell them, when you first came in to see us, that was...
Well, yeah, I was always looking tired. It didn't matter how much rest I got or how much, great foods I was eating, and I just kept looking tired. And I'm in the industry, and I heard that Dr. Raval had these treatments, and so I went in to see him because I heard he was the best at creating these new treatments for the eyes.
So some of your main concerns, you just said, getting a lot darker.
The darker and the groove.
The blood vessels kind of coming up to the surface.
Yeah.
So we did the first step already, which was we added a hyaluronic acid filler into the grooves of her eyes, and you can already see that she looks dramatically better than she did beforehand. So the second step, which we're going to show today, is the laser peel, the part that stimulates the collagen, thickens the skin, which also reduces the darkness. The most common concern that people tend to have is, what's the peel like? Does it hurt? Is it how much downtime is there? And that's why we thought it'd be a great way to kind of show people by actually doing a peel on TV to show it's really not that bad.
Right.
Most people get a mild sunburn looking appearance for about 2 to 3 days, but you can cover it with makeup after 24 hours. And then after that, it's just all gravy. Everything heals up nicely, and the darkness tends to fade.
And then you're saying with this treatment, what you're doing, and as you're going about to show us, it actually it's stimulating almost like the collagen. Is that a fair assessment?
Exactly. So what the laser does is it heats up the skin, injures it slightly, and as the skin repairs itself, it's laying down collagen, thickening the skin, reducing wrinkles, and reducing the darkness around the eyes.
Do you want to go ahead and start and show us how this
Let's
is
get
done?
some goggles on.
Okay.
One for you, one for me.
And kind of walk us through as
this
is taking
Debbie.
place.
And so what she's going to do, again, since Jeannie's already had the filler, she's going to start doing the laser peel on her cheek. Now, just to remind you, this can also be done on the whole face. And as you can see, she's slowly lasering the skin. The top layer is coming off. And as this heals over the next 2 or 3 days, the collagen will be stimulated to grow back on.
Now, as this is going, Jeannie, what are you feeling? Kind of describe that for us.
It's really not very painful. It just feels like a little tingle under the eye, and it goes away instantly.
Is it almost like a little burning maybe, or just the tingling?
It's just like a tiny little tingle.
Oh, look at that, and it's that quick.
And that's it. So one side is already done, and that's all she needed. We're using a newer technology. It's an erbium YAG laser, what it's called. And in contrast to some of the older technology, the heat produced is actually much less. Because it's much less, the pain is decreased, and the downtime is minimized. But the results are pretty much the same as some of the older techniques.
So as you look at me there, so what I saw, what happened are those two areas right there.
Yeah, and then see how she's got kind of the whitening here? That's really kind of the skin that's been excess and that has been removed off.
Gosh.
We will wipe that down and just give her some creams to help her heal up over the next couple days.
You can't really see that. So you could come into Dr. Raval's office, get that done during maybe a lunch break, and then go back to work. It's that quick.
Yes. In fact, sometimes we call it the lunchtime peel because you can get it done over your lunch period.
Yeah. And how much downtime is involved?
You know, really when we say downtime, it's like 24 hours where you need to keep a cream on there and you can't wear makeup. But after 24 hours, you can add makeup, and really you can go out and no one will know you had anything done.
And you brought in some more examples of
yes, we
befores
did.
and afters. I'd love to see these. So
now these are some examples of patients who had a full face peel, but they also had the filler to the lower eyes. And then not only did we peel their lower eyes, but we did the whole face. So you can see a dramatic improvement over the entire area.
Oh yeah, look at that.
As you can see, the peel really does help the entire face. It also smooths out wrinkles, sunspots, age spots as well.
Kind of does all that
Yes.
with one swipe.
That's correct. Now this patient had 3 peels. She had a little bit more sun damage. We did the filler around the eyes, did a little bit of Botox to the forehead, but you can see the dramatic improvement you can get just from our in-office treatments.
Yeah, you can. They just brighten up.
Yes.
Especially when oh, now look at that, that contrast.
Yeah. And again, a lot of improvement, as you can see here, with not only the darkness, but sunspots, age spots, and wrinkling.
And in treatments, as you say, they probably with the sun damage kind of differ with most patients, and you give them the consultation and go through what it's going to take.
Right. And we do a skin analysis. We have a Visia skin analysis, and we can go over all the details of their skin, all their concerns, and then we can come up with a treatment plan that's kind of customized for the patient, for their problems. And then depending on their ethnicity and their skin type, we have to alter things as well. But that's the nice thing about this peel. It's actually pretty safe for all skin types.
And then I'm sure when they leave and they see all the wonderful work that you've done and they have this new fresh skin, there is maintenance after. You can't just go back.
Yeah. People say, well, how long does this last? Well, the changes on the skin are permanent, but you continue to age is how we really want to answer that. You know, a lot of times, so as you age, your skin will change. As you get more sun exposure, your skin will change. And so it's just one of those things where maintenance is required because you're going to continue to age and have concerns over time.
Wonderful. And you have a great special. I'm going to tell everyone about that as well because they need to come in and see you.
Yeah.
It's great work. You look great.
Thank you.
You look great too, Debbie.
Thank you.
Good job. If you are interested in treating those dark circles under your eyes, now is the great time to do that. Call Dr. Raval's office and book your appointment by October 10th to get 1 unit of Restylane to the lower eyes areas that we just discussed and receive a micro laser peel or photofacial to the lower eyes for free. This is a savings, folks, of $300. Any additional filler or Botox will be offered at a 20% discount as well. So this is a great savings here. This special is only for a limited time, so call today. Call before October 10th. Just do it today. Here's the number, 303-381-FACE. That's 303-381-3223, or you can also visit ravalmd.com. This segment was paid for by Raval Facial Aesthetics.